There's a lot of confusion around medications for schizophrenia. Which medications work well? What about the side effects? What happens if they miss a couple of days? And what if they struggle to take medications regularly? To help you out, we are breaking down the most common medication-related questions in this video. Feel free to skip to the part that answers your question. The first question is, which medications work well for schizophrenia? I'll come straight to the point. No one can guarantee that a particular medication will definitely work for a person with schizophrenia. Why? Because every one of them is different. It depends on how severe the symptoms are, and some people may respond to a certain drug and some won't. What does a doctor do? They experiment carefully. They start with a medication, maybe a first generation or a second generation antipsychotic, and they observe how the patient responds. They look at both the improvements in symptoms and any side effects. If something is not working, they adjust the dosage or switch medications. It takes time, and yes, this can feel frustrating, but only this time will ensure that the person gets the right treatment with minimal side effects. Now, the second part is, are there side effects? Let's be real. Side effects are part of the treatment. Some patients might feel drowsy, gain weight, or experience muscle stiffness. But the good thing is that these side effects can be managed. The doctor will monitor the patient closely and adjust medications if needed. You have to remember that finding the right medication with the fewest side effects is possible, but it takes time and patience. That's why sticking to a treatment plan is very important. The third question is, what happens if they miss their medication for a couple of days? This is something many families struggle with. What if they forget or skip a couple of doses? Or worse, what if they intentionally stop taking their meds? This worry is valid because people struggling with schizophrenia make this mistake. What they'll do is they will skip medications for a few days. Then they'll notice nothing has changed and that they are feeling fine. A few days or weeks later, symptoms will come back stronger, like hallucinations, paranoia, or even relapse. This often leads to inpatient care and intense psychotic episodes. See, schizophrenia is a long-term condition. The medications are working to stabilize the neurotransmitters like dopamine and serotonin. In order for these medications to work, they have to stay consistently in the body. The point is that even if they don't notice any immediate changes after missing doses, they are at risk. The symptoms will escalate, sometimes suddenly. So it is crucial to make sure they stay on track with their medications, no matter what. The fourth question is, what if they refuse to take medications? This problem is very common. In this case, professionals will prescribe long-acting injectables. They are given once a month or every few weeks, and this ensures the medication stays in their system even if they forget to take the tablets. Having said all that, one thing is for sure, consistent medication is non-negotiable. We can only help them psychologically navigate their emotions when they are in a stable mindset, and medications play a key role in making that happen. If you ever feel stuck, reach out to your doctor. There's always a way forward, whether it's adjusting doses or using injectables. The goal is to find a treatment plan that works and stick with it so that your loved one can live a stable and meaningful life. Thank you for listening.